And also we will, the exam will cover the inhalational drug delivery system, and the ophthalmic and nasal aortic, and we will also cover all those solid dosage form. So we will cover the powder, granules, capsule, tablet. So, and the Monday's lecture will not be covered on the exam. So now let's first talk about this parenteral dosage form. For the parenteral dosage form, first you need to know what is a sterile, what's the concept of sterile. So you really need to differentiate what is sterile, what is paraben-free. And then you need to know which type of dosage form requires sterilization. So you need to know all those injected formulation need to be sterile, and all those inhalational dosage form need to be sterile, and there's the dosage form given to the eye, aortic, and the nasal need to be sterile. And then we talk about the needles used. So you need to know the requirement, what's the factors will influence the selection of the needles. So basically, it's where you want to give the injection, and then it's about also you need to consider the formulation of your you are going to inject it, whether there's viscous and whether they're diluted. Then we start to talk about different type of injections. So our focus is IV, IM, sub-Q, and ID. So for this part, so the most important thing is, you should start it by comparing each lot. So what we really want you to understand is the formulation limitations of each type of injections, and also you need to know the absorption rate and the duration of actions of each type of injections. Generally speaking, when you have the fast rate of action, fast onset, then you will have a shorter duration of action. And then we will talk about this injection volume limitations. So, and then you do not need to know the needle size, the specific number, but you know on the skin surface, generally speaking, you need a short needle, but for the deeper in the muscle, you need a longer needle. So, and also you need to understand, so how we monitor, how we influence the absorption rate of each type of injection. So to increase the injection, we should try to increase the blood circulation, so more drug will be carried away. Then there will be the drug concentration gradient, so more drug can get dissolved, can get distributed faster. So for those, you need to know from the name. So for example, if I say this is full injection, you know this is provided as a dry powder. So you need to resuspend and reconstitute this formulation, make it a solution. So it's important to know the solvents or vehicles used in this those parental dosage form. So you need to know what is the water for injection and what is the sterile water for injection. So which type of vehicle can be given directly to the patient as a blood volume expander or used to flush the infusion line, and which one is sterile and which one does not require to be sterile, and which one has to be limited within 30 milliliter, cannot be used for neonate, because this is very important. So you in the hospital or in the pharmacy, you will face those problems. So this slide is really important. You need to know all those parental dosage form has to be sterile, has to be paraben-free, has to be, the solutions should be free from articulated material. They must reach this all the standards. So, but you need to know some standards is they may vary from the normal range because we want to maintain the stability or maintain the solubility of the drug, but you need to know which standard must be met. Then we talked about this sterilization method. So this is also very important. So you need to know what's the difference between the vertical and horizontal laminar flow hood, and this what is the purpose, and what is and which type provides the protection for the environment and the people who operate. Then we talked about the most commonly used sterilization method. So our focus is actually is the top three. So the steam, sterilization, dry heat, and filtration. You need to know their applications, their limitations, and which one is the most commonly used one, which one is the most reliable one, and for which one can be used for heat-sensitive material, and also for which type of filter you need to use. So, and also for every dosage form, we will talk about the quality control of the dosage form. So for this quality control part, you do not need to know the detail how those tests got to be done, but you need to know what tests are required for each type of dosage form. For example, the parenteral, we need to test their sterile test. We need to have this paraben test. And then what's the name of those tests? Okay. So for the inhalation dosage form, so the first important thing you need to know is the application of this inhalational dosage form. So more commonly they are used for local effect, and what the advantages offered by this inhalational dosage form. And then we talk about they also can be applied for systematic use. And then you need to know what is an aerosol, and also the three devices used for deliver aerosol. And so one very important slide is to understand the particle size is very critical for the distribution and deposition of this inhalation aerosol in the respiratory tract. So generally speaking, if we want this drug get deeper in the lung, so we want the increase this sedimentation effect, this procedure. So that's why we should slow down the inhalation airflow rate, and then we should ask the patient to hold their breath. So those, and also we need to control the particle size of this aerosol. So most important thing you need to know is the comparison between among these three devices. Is the metered dose inhalers, and then the dry powder inhalers, and then the nebulizers. So what advantages offered by each type of device? So yeah, when you started, you need to compare and each type of device. So for example, this, and also you need to know for this metered dose inhaler, what the major components. So, and what's the function of each component? So, and also, what's the limitation of each device? For example, MDI, you need the hand-mouth coordination. So, to reduce this requirement, we have some spacers. So for nebulizers, you just know this. Right now on this market, there are three types of nebulizers. You do not need to know the detail, but if you see the name, you know this mechanism you applied by nebulizers. So the most important slide in this lecture is the advantage and disadvantage of each device. Then for those parts, for this nasal and ophthalmic or those aortic formulations, so for this part, so you need to know all those formulations need to be sterile, and then what the advantages offered by each type of formulation. And then for contact lens, you need to know there are three types of contact lens, and what the advantages offered by this each type. So for example, hard contact lens is more durable, soft contact lens is better gas permeability. For nasal drug delivery, you know there can be applied for local effects, for systematic effects, and also can be given for CNS delivery. And the most important thing is the requirement of this nasal formulation, because you cannot give some formulation that be too irritating to this nasal mucosa, because nasal mucosa has this function of sense of smell. So that's why you need to know all those requirements. So the pH, the drug concentration cannot be too high. So you know what are the commonly used nasal formulation. pharmaceutic formulation, you also need to know the most important thing is what can be used in this ear canal. So, and what type of formulation used in the ear canal. So we talked about this serum removal solution and this slimness ears. Then we start to talk about the solid dosage form. So I think we just have this lecture this week. So for powders, so the most important thing you need to know is the influence of the particle size of powders and also the particle shape of the powders, and the particle size is a distribution. It's not all the uniform size shaped particles. And you need to know why the particle size and shape are so important, because powder and granules are the basics of our other dosage form. They are used to prepare suspensions, tablet, capsule, ointment, and then how to categorize the particle size, and based on the USP standard. So all those, then for those technique, those method, so you only need to know those manual method, not pay attention to those manufacturer method. Then you need to know what is trituration and the navigation, polarization. So what their applications, what the advantages it offers. So for geometric dilution and what the method used for blending these ingredients together. So then we talked about this medicated powders. You need to know this what their application. So bulk powder, divided powder, dusting powder, bulk powder. So very basic stuff. So we talked about granulation. So you really need to understand why we add this extra step. When we talk about tablet, we have those dry granulation, white granulation method. So why we take so much effort to make the powders into granule? So it offers better flow properties. So because we change the shape, we make the bigger particle size. So you need to understand the basics. So for those granulation methods, you just know the name, dry granulation. That means no exposure to moisture, no exposure to heat. So we emphasize this in the tablet or capsule part also. So here another thing you need to know is the effervescent granule, effervescent salt. So what's the reaction? What's the excipients used in this type of granule, and also this is same in the effervescent tablet. Then we start to talk about capsules. So for capsules, even though it's a very important dosage form, actually we didn't talk much about it. Then the one thing you need to know is what made of this capsule shell, and then why those what added to this soft capsule shell make it flexible and soft, and then the solubility property of gelatin. They gave the desired properties of the capsule, and then compared to tablet capsule, it's easier to be swallowed. And then the capsule shell size are give the different number. Then you know the larger the number, the smaller the capsule shell. So for tablet, our focus as a pharmacist, you need to know the advantages offered by each type of tablet. That's our focus. So you need to really understand all those parts. What we covered last lecture and then early this lecture. And then we talk about, you need to know the excipients used in tablet and what their function. And also just try to know those some this yet highlighted examples. So for those manufacture method, you just know the name and the advantage, disadvantage. So for coating, it's important to know the 3 coating methods and also the advantage or the disadvantage for each type of coating. Then for the quality control, you just need to know the name. So appearance, hardness, stability. So you need to know what is not required for tablet quality control. Okay, I think that's all for today. So if you have any questions, you can email me during the weekend.